Well, I hope this doesn't get me censored or something like this, because this video is going to give you a lot of great information on your health, and it's for free. It doesn't cost you a lot of money. This is geared mainly towards chiropractors. So if you're a chiropractor, I know there's a lot of chiropractors watching my videos. I'm going to help you discern between whether a person has an upper cervical or a lower cervical problem, to give you really the bullseye of where to adjust people. And if you're not a chiropractor, this should be very interesting to you, because you can almost do these tests on yourself and really understand and know what is going on. This is going to be hopefully a great video that you will really find a lot of benefit from. Before we do that, today's sponsor of my video is Magnesium Breakthrough. This is a company called Bioptimizers. I really love Magnesium Breakthrough. Why are you not taking magnesium? I don't get it. It's such a simple product that has so much benefit. For one, let's say you have neck pain. It helps with muscle spasms. It helps with your heart. It helps our body for our blood pressure, our blood cholesterol, our blood sugar. It has so many different benefits, but really what it boils down to is that the best benefit, in my humble opinion, if you're gonna pick one, would be sleep. I mean, what I do is I take 2 magnesium tablets at nighttime before I go to bed. It helps relax you, and you sleep like a baby. The great benefit of this particular product, as opposed to any other, is the Magnesium Breakthrough has 7 different types of magnesium in it. And our body absorbs different magnesiums differently. We utilize different types of magnesiums for our body. So I'm going to put a link down below in the bottom of the description, or in the description, and with a discount code and all that good stuff. Look at the product. Why are you not taking magnesium? It's almost a no-brainer that it will improve your health quite a bit. So let's get into the video. The difference that we're really talking about here is whether the person has an upper cervical problem or lower cervical. They manifest in many different ways. Symptom-wise, typically a person with an upper cervical problem, they're going to have headaches. They're going to have headaches that start in the back of the head, that go across maybe to above their eye, on their temple. Usually it's on one side. It can be both, but more often, I'm going to say 9 out of 10 times, it's on one particular side. So if you're having a headache that's on one side of your neck, it starts at the back of your neck and goes across to the temple and the forehead. Man, that's an upper cervical problem. A lower cervical problem would be where a person typically kind of grabs their neck and tries to always constantly rub their neck. They may get numbness or tingling down their arm into various areas. So symptom-wise, those are really the differences. But the pain typically will clue you in, but it doesn't tell you exactly where to adjust. And I'm going to give you the benefit of my 26 years of experience as a doctor of chiropractic. I've been doing this a long time, and when I first started, I never used these tests. I think physically testing the patient and motion palpation are the best ways to determine whether you should adjust an area or not. Don't go based on the symptoms. In other words, just because a person has a headache doesn't necessarily mean you're going to adjust their upper cervical area. If you adjust the wrong area, it's equivalent to doing surgery on the wrong side of the patient. Sure, you did the procedure, but it did not work. So let's get into the test. Let me show you exactly what to do. The first test is to test for upper cervical problems. Now what you're going to do is you're going to have the patient tilt their head forward and really rotate and round their neck forward. Once it's forward, like their chin is down by their chest, what you're going to do is you're going to have them rotate to one side and rotate to the other side. Very often there will be a significant restriction of rotation to one side or the other. And the reason why this occurs is because the occiput and C1 and C2 are being flexed, and the rectus capitis posterior major, rectus capitis posterior minor are the muscles that are being pulled and stretched. So if the person has a problem rotating to the left, for example, then that would be the right-sided problem. Patients get this confused because they think, well, I can't turn to the left, so therefore the problem is on my left, but you're very likely going to be adjusting the person on the right. If that test is positive, where there's a difference of rotation on either side, then I will use motion palpation to determine where exactly I'm going to adjust the patient. So I may adjust their occiput, I may adjust C1, or I may adjust C2. Those are the likely areas, but you really need motion palpation to determine where specifically you're going to adjust that, and I'm going to show you how that's done in just a moment. But let's go to the second test that I use. Now this is to determine whether it's a lower cervical problem, and what I'll do is I'll have the patient lift their chest a little bit like this so they get their head above their shoulders. I will have them lean back about 10 degrees, and then I will have them bend to one side or bend to the other side. Very often the patient will get a pinching sensation on the side that they're going to. We're not talking about having pain, let's say, on the left side when they go to the right, because that would indicate some type of muscular problem. I'm talking about where to adjust them. So if they go to the right side and they get pinching on the right side, that very often is telling you that they're having a facet problem of the lower cervical spine. So then I would follow that up with motion palpation, and very likely you're going to be looking at between C5, C6, C6, C7, C7, and T1. So by doing these simple tests that literally take just a couple minutes, you are going to be able to isolate which area then you can motion palpate the spine and determine which facet joint that you are going to adjust. Now let's talk about motion palpation and how I use that procedure to really pinpoint and find the bullseye of where I'm going to fix the patient. All right, so I have a plastic model of a spine, and first thing is the motion palpation is not the only way to determine where a person has problems. However, in my humble opinion, the experience I've had doing Gonstead for all my practice life, as well as in school, I have reduced the amount of x-rays that I have taken on patients. Now, x-rays are a very valuable piece of information and can give you lots of information that you wouldn't otherwise see. When you have a person who has a spinal problem and you see that patient over a number of years, you simply cannot be x-raying them every single time they have a boo-boo. They would die of thyroid cancer when it comes to the neck. So you can't be x-raying every single patient every single time. The other thing is that static x-rays, just taking a picture of someone not moving, is of very little value in determining where to do an adjustment. Now, I get it. I'm upsetting some people. Everybody's going to get their little panties in a bind for this, but you know it's true. When you look at the research and you start, if you've been in practice for, I'm going to say longer than 10 years, you're going to start to question some of these things that were taught to us that were really determined and figured out back in the 1940s and 50s. I mean, we should be progressing from that. The best type of x-ray, just from a intellectual point of view, the best type of x-ray to determine where the fixations are in a person's spine are motion studies, where they actually take the person and they'll x-ray them, and the patient will bend backwards and bend forwards, just like this, back and forth. And you can literally see where the restrictions are. Now, some of the studies on motion palpation have been troublesome because they can't seem to find ways to isolate one item when you do a study. So motion palpation is not a drug, it's a procedure, and unfortunately it depends on the skill level of the practitioner. If you do a normal drug study, you can take 1,000 people on one side, 1,000 people on another, and give one person a sugar pill and another person the drug and see what happens. But when it comes to a skill level, imagine taking 1,000 baseball players on one side and 1,000 baseball players on the other, and trying to analyze their swinging style when they hit a baseball, and trying to come up with one item that is the one thing that will determine whether someone is a great baseball player or not. You can't do it. And that's the problem with studying something as complex as motion palpation. So knowing what we're looking for, though, we can have a good understanding of how to do motion palpation, and you get better at it with time. So again, the more experienced you are as a chiropractor, the better off you can be at motion palpation. Unfortunately, I've been to some chiropractors that they've never mastered motion palpation. So they really don't use any exam procedure to determine where to adjust. They go based on the patient's symptoms and based on tenderness, and it'll get you close, don't get me wrong, but I think there is a better way. So what you would do in this case is, if a person has an upper cervical problem, how do I motion palpate it? You have to understand that the occiput is designed for mainly flexion and extension. And so what I will do is I will place my hands on the back side of the occiput near the mastoid process, and I will try to glide in the direction of the condyles, which is like this. They're not straight forward and back, they're angled. So I will try to glide in this direction, and then I will try to glide in this direction. And what you're looking for is that end play feel where there's a give to it. So I'm going to do this right here. There is a give to the joint on both sides. So the angling is very, very important. You have to go and move like this. The atlas, which most chiropractors should be able to do, I'm going to take my finger right underneath the occiput, right on the posterior aspect of the transverse process of the atlas, and I will have them rotate, and once I get to end range, I will take my finger and just push a little bit, a couple millimeters, to see if there's that end play feel to the joint. Then I will take my finger and place it on the facet joint of the second cervical vertebrae, rotate their spine, and do an end feel. You do that on both sides, and you will be shocked at how, with experience, how easy it is to determine, do they need an occiput adjustment, do they need an atlas adjustment, and do they need a C2 adjustment. Now at the end of the video, I'm going to put a box here of how I do certain adjustments and things of that nature, so you can watch those later. The lateral part of the lower cervical spine is very similar, however I will use lateral bending. Again, if the patient had a problem bending to the spine, if you were to do a motion x-ray, what you would see is there would be less opening on the left side of the spine and less gliding downwards on the right side of the spine, and there would be a fixation between 2, maybe 3 vertebrae. So what I do is I just take my hand, I put it right above the trapezius, right next to the scalene muscles, and I will use my hand and I will have them bend, and I will apply a gentle end play motion at C7, C6, C5. And what you'll find is that sometimes all 3 might be fixated, but there will be one that'll be exquisitely different than the other 2. That's the bullseye. That's where you want to adjust them. So we know there's a lateral bending restriction, and then I will check to see if there's a rotational restriction. So again, I'll have them rotate, and I will use my fingers and press on those facet joints. I personally do not like the original style of motion palpation that I first learned in Gonstead, which was to take the fingers and put them on the spinous process and rotate. And the reason why I don't do that is, and I don't know if it's simply because of the area where I live, but once their BMI is above 20, if they have any type of fat tissue in there, it's very difficult to find the spinous process, particularly of C5. C6 is a little easier, C7 is even easier than that, but again, unless you're treating right next to Jenny Craig, it's not going to happen. You're not going to be able to really be great at finding a C5 spinous process and getting end play motion of the facet joints, because the lever arm is just too big. So in my humble opinion, it's better to place your finger directly on the facet joint, and that way you can isolate where that motion palpation restriction is, and then based upon the movement patterns that are limited, you would adjust into those movement patterns and correct these people's problems. So please, 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 if you're a chiropractor, try to be as specific as you possibly can. I know it's difficult. I'm in practice. I get it. Sometimes certain patients are more difficult than others, but the more specific that you can become, the better chiropractor that you eventually become over the course of years. And then it doesn't become a mystery as to why some people get better and some people do not. But quite frankly, you see this all the time, the random type of adjustment where the body is rotated to the right, the body's rotated to the left. The same adjustments are done to every single patient, every single time, regardless of the person's symptoms, regardless of who the person is. The same adjustments are done to the same people. That's analogous to going to a medical doctor and the doctor just giving amoxicillin to every single patient that walks through the door. You wouldn't want to see a medical doctor like that. Why should we be chiropractors like that? So if you want to know further of how I do adjustments, I'm going to put one video, and I have others, but I'm going to handpick one video where you can see exactly how I go about doing an adjustment to the spine that's very specific, very isolated. I know exactly which joints are being done. And if you like these types of videos, thumbs up, subscribe to the channel, hit that bell notification, and of course, get yourself some magnesium. The link is down below. Look into the product. It's fantastic stuff. It'll really help you as well as your patients.